My name is Gemma Donnelly. I'm the Director for Allied Health Professions and Clinical Leadership in Bob ICB. So I'm very fortunate and blessed to be part of the Allied Health Professionals leadership team here with my colleagues who I'll introduce shortly. And it's really brilliant to see the numbers racking up and see all of you here today, because this day is all about our support workers and you as support workers. And whichever one of the brilliant AHP professions that you represent, you're an absolutely vital part of our teams, making a difference every day. And really today we wanted to give everybody the opportunity to celebrate that contribution, connect with peers. I know that's not going to be as easy because it's a virtual event, but actually there will be more of us in the room, and explore your own professional development as support workers. We've got a really busy day. We're kicking things off with an absolute highlight. We're incredibly lucky to have secured Professor Richard Griffin, MBE. And Richard is somebody that I've known of for a very, very long time. He's a leading national voice when it comes to support worker development in the NHS, and spent years researching and championing the role. And that passion for raising the profile of support workers shines through in everything that he does. And I think we're going to have a really inspiring start to the day. So no pressure, Richard. I'm sure that's going to be amazing. And then we've got Grace Smith, who actually started her career as a support worker, who'll be sharing some research that she's done for her master's degree around the lived experience of AHP support workers. And they will, reflect the challenges and the impact of the work that you do. And then later in the morning, we'll be joined by Shilpa Bhatt and Claire Wardle. And that's a really practical session on career conversations, how to get started, what opportunities are out there, and how you can take control of your career journey and go further. So we've got a bit of an optional webinar over lunch. This is just a beautiful coincidence that there is a national webinar today called Empowering Support Workers to Thrive. So please feel free to either join that webinar. You can register on the link there, or go and have a break and have some lunch. And then in the afternoon is about your development, and about two brilliant practical workshops lined up, both led by Nikki Wheels, who is our resident expert on personalised care and decision making. So first of all, she'll be exploring theory and practice of motivational interviewing, which is a really important skill for everybody to have. And I think that's the sort of the beauty of our AHP professions, is that this is our USP. This is what we can be really great at, followed by a session on shared decision making. So settle down. Please do take part. Please do ask questions and enjoy the day. It's a real time for you. It's your space, your time. And thank you very much for being here. And thank you as well for everything that you do in your work to make a difference to your service users and your team and your organisations. It's absolutely invaluable. So I'll just go through a bit of housekeeping. Joanna is keeping me in check. Thank you very much. I'll do some introductions. So first of all, I'd like to introduce Joanna Lancian, who is our AHP Support Worker Project Manager. I think I'll probably give everybody the wrong titles, but look at their team's thing. But Joanna's with us for a year on secondment, working to really promote the support worker agenda, and runs a very brilliant support worker forum, and is making a real difference. So that's brilliant. I'd also like to introduce Sajda Hanif, who is our AHP Workforce Programme and Retention Lead, words to that effect. And Sajda's been working in our AHP workforce space for probably almost 4 years now within Bob, and is fantastic. Everything there is to need to know about AHP and workforce, Sajda's our expert. And then we have Geraldine Conway, who is, thank you for putting your camera on, that's brilliant. And Geraldine is also with us as an AHP professional project manager, and is working on lots of things, including educator and educator support, and actually doing a brilliant piece of work around promoting the how support workers can become educators for pre-registration AHP, actually speech and language therapy, isn't it? Really successfully, giving people a lot of sort of satisfaction around fulfilling a new role in their support worker role. Is that everybody? Have I missed anybody? Hopefully not. So that's us. Please do, if you have any challenges around tech, please put it in the chat and we'll try and work that out. Obviously, we are on Teams and that can bring its own challenges. If we have technical issues, we will just go with the flow and adapt as we do so well, and leave and come back, or please do please do let us know if you're having any challenges with that. And also, please do use the chat to comment. It's always really lovely, I think, for presenters to feel like you're connecting with what they're talking to, and that, you know, that you're being listened to. And I think that's especially hard when you're on Teams. So do put your questions or comments in the chat. Do keep your microphones off, if possible, please, so that we don't have any background noise. If you would like to your camera on, that would be lovely. Again, it's really nice, I think, when people are presenting, to see faces rather than little blobs with initials in, but understand that some of you may be in shared offices, etc. We will be recording our morning session so that we can use that and put that on our resources, so that we can spread as much of the brilliance that we will hear as far and wide as we can. Please do raise your hand if you have anything urgent that you wish to do during the presentations, or if the presenter invites questions as we go along. Sometimes it's not always easy for the presenter to see hands, so I'm sure Jayana and Sajda and Geraldine will be keeping an eye on that as we go along. We've talked through the agenda. We've tried really hard to put in little breaks in between each speaker so that you have a chance to go and rest your eyes, and just get a bit of a break, have a comfort break, because I know, again, it's not always easy just looking at a screen for long periods of time. So hopefully that will meet your needs. But obviously, if you do need to take a break or leave and come back, then please do so, whatever's going to meet your best your learning needs, and also just address your well-being. And do react. I think I saw a little heart a minute ago, which is fantastic. But yeah, do let us know that you're there and enjoying it and hearing what we're saying. So I really hope that you have a really good day. I'm looking forward to hearing a lot of the presentations, and thank you very much indeed. So what's the next slide? That was the agenda, wasn't it? I think we've talked through that. Yeah. And then I think I'm handing over now to Sajda. Is that right?
That's right.
Good morning, everyone, and a very warm welcome. Just wanted to take this opportunity to share our resources with you all. And we have our AHP support worker training Bob Padlet, which we'll be sharing the links with. We'll place them in the chat, and we'll be sharing the presentations with you all at the end of the day. The Padlet has information on everything that we'll be discussing today and a little bit more. Over time, recently, Jayana and Geraldine have now color-coded this. So if you were looking at training opportunities related to leadership, all of those kind of courses and opportunities are in one color. Anything related to education is in another. Anything professional development is another. And anything overall, any recordings that we've done of previous webinars, including this, will be on there. And that's for you to have a look at. And any feedback or anything that you feel like is missing from there, please do get in touch with us, either Gianna or myself. Next slide, please. So as Geraldine said, we do have our monthly Bob AHP Support Worker Network meetings, which our amazing Gianna runs. And this is just our upcoming meetings, just for you guys to take note. It'd be really lovely to have you with us. So upcoming meetings include on the 10th of July, we've got our professional bodies. So that's coming from physiotherapy, CSP, and the Royal College of Occupational Therapy, and looking at what the professional body is, what they have offer for support workers, and how can you access all of that information. So it's really a really good one to join. And then we have another one on the 30th of July, and that's talking about, let's talk about neurodiversity. So it's about what is this, what the unique strengths are, creating that inclusive environment. And that is going to be led by a AHP support worker. So I hope you will all welcome her. And then on the 28th of August, we have Nana joining to talk about the Aspirant Career and Education Development. And this is for support workers working in cancer services and how you can utilize this digital platform to be able to look at your career and education development. And then in September, we've got support worker speakers, someone who's completed the Edward Jenner Leadership Program and sharing their experience, and someone who's currently on a apprenticeship route and sharing that experience with you. I won't give away any more, but those are our upcoming meetings. These are advertised in our monthly Bob AHP faculty newsletter, but if you don't have them, please do get in touch with Joanna and she will share the meeting links with you. Thank you. And I'm going to hand over to Richard Griffin.
Lovely, thank you, and good morning, everybody. It's an absolute pleasure to be speaking to you today, and thank you for that introduction, Gem. I was slightly blushing as you were doing that, I must say, and I was reflecting actually the first time I spoke. I used to work at Bucks New University, which has a campus, as some of you will know, in High Wycombe. And I think the first time I spoke to a Bob event was probably a decade ago when the care certificate was first being introduced. And I think just hearing what you've got planned over the next few months is a really good sign of actually just how much progress has been made over the years since the care certificate and other documents were first introduced. So I'm going to cover a lot of ground. My email will be at the end, and I will put my email into the chat as well. We will be sharing the slides with you. So if anything that I cover, you want more information or like a separate conversation, and you don't have time today, then do feel free to contact me. And I thought I'd start, could have the next slide, please. I thought I'd start with, today's all about development and it's all about careers. So I thought I'd start by giving you a bit of an introduction to myself, but doing that a concept of two ideas that have come out of research on careers and how people think about their careers. Something that's called life stories and something that's called imagine futures. So I'm going to talk about just very briefly myself and how those concepts apply to me. And that's a picture of me, I think probably about 4, and I think that's probably the only time I ever did any DIY, actually. I don't think there's any evidence of me doing DIY subsequently to that event, but anyway. And I was born in Newbury, so I was born in and brought up in Berkshire. My family are from Berkshire, and most of my family are still in Berkshire. And we're told, all of us are told stories about our lives and how our lives should progress. It's not always a direct story. It's not someone saying to you, this is what you should do. Sometimes it's the world around us, the role models that we have, our parents, what they do, sets a kind of idea we might have about what we can do. Some of it is direct. So my careers advice when I was 16 was, do you want to join the Army, Navy, Air Force, or do an apprenticeship at Aldermaston or Harwell? That was it. The idea I even stay at school was not something that was talked about. And that can shape how we can imagine ourselves in the future. So, for example, nobody in my family went to university. I was the first in my family to go to university eventually. So the idea, I couldn't imagine going to university. So my sort of life story started as, born in Newbury, get a job, leave school at 16, get a job, get married, have kids, stay in Newbury. So that was the life story. And as a story I started, and in the corner there, that's NatWest Bank, which I think is still there in the marketplace in Newbury, which is where I actually did start working at 16. And my parents were really delighted that I was actually working in a bank. One of my jobs was printing checkbooks, which sounds like some job from the medieval period these days. But anyway, that's a lot of what I used to do, is print everybody's checkbooks. But my life story sort of changed. I was born in 1963, so it was 1979 when I started working. And it changed, a number of reasons it's changed, but there's a couple kind of significant events. Firstly was that job. And the people at that bank said, they might have spotted something in me, I don't know. They said, actually, if you want to progress, if you want to do more, then what you probably need to do is go back to school and do A levels, something I hadn't considered doing. And I was also at that time very into music. I was a punk. I had other pictures I could have shared, but I decided not to. And I was in a band locally, and we did a fanzine, which basically we typed and interviewed people, typed up and printed it and sold it. And it was called No Cure. And if you're the same age as me and you bought one of those, they're worth about £80 apparently. If you got a copy, it was 20p when we sold it. But doing that gave me a sort of sense that actually you can do perhaps a bit more. I have a bit more agency and choice in my life than I thought I might have done. And as a result of that, I did eventually, and for other reasons as well, go to university or do my A levels and then go to university. And I will say, as a white man, I think the story, was better than it could have been. And there are other stories if, you're a woman or are a woman or you come from an ethnic minority, this is different to that. The point of this, not only to sort of introduce myself, but actually it's always worth thinking about what are the stories we tell ourselves. I'm going to talk a bit later on about this notion of I'm just a support worker. And it's not, I want to be really clear, this is not about positive thinking. It's not about saying I can imagine something better, so therefore it's going to happen. You still have to work hard and develop yourself to progress. But it's something about perhaps reflecting sometimes on the stories we are told and what we might think our future could hold compared to the actual opportunities that they are. So since then, I did go to university. I'm now at King's College London. I'm Professor of Healthcare Management. I've been very lucky. Certainly for the last 15 years, my career has been solely focused on support workforce. In the last 5 years, I've focused very much on the AHP support workforce. And I did previously spend time working for... Yeah, brilliant. And I did spend time working for Child Society of Physiotherapy for about 13 years as well. So if you have the next slide, please. So I'm going to talk about trends and challenges. I'm going to talk about opportunities, including the career portfolio. I'm going to talk a bit about this notion of a voice, having a voice in the workplace and collaboration. And as I said, we're becoming this quite quickly. So do feel free in the chat or independently to get in touch with me. So next slide, please. What I want to say first, though, is why I think you matter as a workforce, why the AHP workforce support staff matter. I mean, there are a number of reasons, but the ones I think are most important are firstly, obvious point, you are a large and growing part of the workforce. There's a lot more of you now than there were when I spoke 10 years ago, and there will be more in 10 years time. So that is an important factor. Support workers generally, including AHP support workers, can often be the key bedside presence. So research suggests if you are in a care setting, particularly if you're in a hospital, if you're a patient or your family or others, the people you're most likely to come in contact with the most are support workers. And there is some evidence that contact with support workers does lead to reduced anxiety. I've personally, with my grandparents, when they were in hospital in Reading, it was the support worker who was sitting with them, who was talking to them, and when we came, were talking to us about what was happening. So very often the key, and I see it also actually, my grandson has epilepsy, I see it with him as well, actually, the role that support workers have, being close to my son and his wife, and to Arthur as well. So your key patient-facing role, and that's really important. We know there's shortages of registered staff. We know we need to increase the registered workforce, whether that's all orthoptists, podiatrists, radiographers, across the whole AHP professions. We do not have enough AHPs in registered grades. And we also know that many support workers want to progress into pre-reg grades. So actually, a lot of you can imagine a future where you are a registered member of staff. It varies by occupation. There's quite good research in radiography. So if you're a radiography assistant, whether diagnostic or therapeutic, around 40% of radiography support workers would like to progress into radiography. We're talking a bit about how easy progression can be. And there are still, unfortunately, barriers, even with things like degree apprenticeships, which aren't available everywhere. But we know that a lot of people would like to progress into pre-reg. We know, as you'll see in that last point, actually, quite often support workers are more likely to be recruited from local communities, be embedded in local communities, so are more likely after going on a degree for a work-based route to stay in there with their employer. So, a really underutilized at the moment supply route. And you'll know better than me the pressures that the NHS are under. You'll know also that, the government, although investing in the NHS, want to see productivity improvements, effectiveness, greater effectiveness and efficiency. And support workers deliver that. So there is a body of research that shows, for example, that this is from Australia, but I did some work with Northwest London looking at occupational therapy, and the statistics held up really well actually when we applied them to occupational therapy support workers in Northwest London. Around 11 to 24% of time that registered staff spend on tasks could be safely, appropriately, effectively delegated support workers who are appropriately trained and supervised. And that is obviously important, that people have the right skills to do work, they have the right governance and safety processes. But just think about that. I think the figure is lower in the community, higher in hospitals. But there's a significant amount of time that registered staff are spending, busy registered staff are spending, that could be freed up by investing in support workers. And we know where that does happen, improvements occur. So we know, for example, patient flow can be improved by investing in support workers. Safety is improved, so less care is missed if support workers are valued in the workplace and invested in, and are improved outcomes. There's some research, there's a number of areas I could have picked, but there's some research around reduced falls where assistant practitioners have been developed to support prevention and also recovery from falls. So it's really good, if you like, business case. And I think what I've seen in my career around support workers, there's certainly a justice case, has been a justice case, but actually there's really good business case reasons about why we should be invested in you even more than we are. And finally, which I've already referred to, but on average, support workers are much more likely to be recruited from local communities, which means support workforce can be more representative of local communities as well. So, and that we know can lead to improved health outcomes. So support workers matter for lots of reasons. You are really, really important. I want to say here and now, thank you, because from my own personal experience, you've really made a difference at certain points in my life. So thank you. Next slide, please. So I was asked about sort of policy framework at the moment around NHS support workers, and slightly frustratingly, there's a lot of policy on the way. The new 10-year plan will probably be published in the next few weeks. The new or refreshed workforce plan is probably going to come out in the autumn, and alongside that, the AHP strategy for England is currently being revised to reflect those plans. So we don't know at the moment what's going to be different. So watch this space. I'm sure through the great work of colleagues, you'll find out what's going to change. It's not just NHS policy that's changed though with new government. We have new policy emerging more widely that is going to be relevant to support workers and registered staff actually. So on Tuesday, the government published its industrial strategy. That includes reforms to skills, to training. And the two most significant things that have been flagged in that is the apprenticeship levy is going to become a growth and skills levy, and employers are going to have more freedom about how that levy is spent. So it will not just have to be spent on apprenticeships, it could be spent on other standalone qualifications. Also within the strategy is a recognition that although apprenticeships are really, really important and valuable and certainly are not going away, there's also a need for perhaps more flexible formal qualifications, so more standalone qualifications outside of an apprenticeship, both of which I think are welcome and both of which I think will make a difference. With the work I've been doing around with professional bodies in optics and radiography, one of the things that keeps coming up is that there's not an apprenticeship pathway available, or I've done an apprenticeship, or I've got a qualification, doesn't mean I'm available, I can do it, or I'm work part-time. There's a real need for standalone accredited qualifications. So we'll have to see what actually emerges in the detail, but the industrial strategy is significant. But although we don't know exactly what the detail is, we know the kind of priorities that the government has. We know the kind of priorities that the AHP national strategy has focused on, things like prevention, care close to home, integration. There's a whole strategy around emergency and urgent care. Patient flow is important, and that wider social impact. So, there's a lot of controversy around benefits at the moment, but whatever happens with that, it is important that people are supported into work who can work. AHPs clearly have a kind of major role in that. So I think it's something about thinking about what part can support workers play in, meeting those policy objectives. And I think on all of those and the other ones we could talk about, support workers have a massive part to play. And what I truly hope is that is recognised in the new 10-year plan and the workforce plan. It's got a lot better. I think it'd be fair to say that support workers have been a bit invisible in policy until quite recently. I really hope that your contribution that you currently make and can make is fully recognised alongside the contribution that your registered staff colleagues make as well. Next slide, please. So what do we know about support workers generally in the NHS? We did a major survey 18 months ago at King's with support of professional bodies and unions. So it was all clinical support workers in the NHS, AHPs, nursing, maternity, ambulance staff, etc. I've drawn just the headlines from that study, and I'll put the link to it if you're interested in seeing the report of it. And I will say, actually, other research that's been done, there's been a big bit of support worker research done in radiography recently. It echoes the kind of findings that we found at King's, so that's reassuring. So I think we've got a sort of reasonably good picture of what we know about the support workforce generally, and I'll talk in a second about AHPs compared to other occupational groups. We know support workers are experienced, they're local, as I've already talked about, but generally an ageing workforce. I think that's true for the NHS generally, but there are a cohort of very experienced support workers that will be retiring. So it's something about how we replace those, how we recruit into entry-level roles. We know sadly there's very patchy access to formal qualifications, which is why it's great to see that Padlet actually in that opportunity to identify the training you need. And when we do surveys and other ones, and I've just done a survey actually with the Ascend programme of cancer workforce, and this holds for support workers in the cancer workforce, including AHPs, quite often the qualification of most support workers will have a national vocational qualifications, which were withdrawn in 2015. So there is something about actually how you form those formal qualifications, including the apprenticeships, how we make sure there's greater engagement with those, so there's more opportunities for you to get those formal qualifications, as well as that wider CPD you need. And this is generalizations. There are places where this isn't the case, but I'm just pulling the kind of national picture. You're really proud of the work you do. You're really infused by the work that you do. You enjoy the work that you do. And in terms of those colleagues around you, feel really supported and valued on average. You're really keen to develop and progress. On average, 2/3 of support workers would like to progress to a higher level of practice than the current level of practice. But also it's great that people want to stay at the level of practice they are, and people who do want to be the best they can at that level. They want to get the training they need to do to be, fantastic band 3, band 4, whatever. But this is a really long-standing issue. This goes back to as long as I've been working in the NHS and before. It's often unclear how you make that journey upwards, if that's what you want to do, or even if it is clear, opportunities are not always available. So I said about those statistics around support workers wanting to progress to pre-reg, quite often though, the actual numbers to do are much less than those who would like to. And perhaps because you are a enthusiastic workforce that want to develop yourselves, which is why again today's great that you have these opportunities to talk about development opportunities, not only what you can do but how you can do it. There is a frustration quite often those opportunities aren't there. There's a perception of sometimes of lack of management support for learning, and that the qualities of appraisals and PDPs are not always as effective as they could be. And I think that's those conversations, and I would urge you actually to join that CSP seminar webinar at lunchtime. I think those conversations are really important. What also though comes through is a clarity now around scope of practice and delegation. So what I can and can't perform in terms of tasks and responsibilities. That can vary by employer. So we do find in one employer you can do cannulation, you're at the same level with the same training, in another employer and you can't. So there's still variation, which means we are potentially underutilising, as I said earlier. But in terms of general scope of practice, I think that's a really big change in the last decade. I think the AHP framework, the national framework and individual professional work has really made a difference there. So that's obviously very good news in terms of scope and practice, being clear in terms of safety and appropriateness. And there's much greater confidence now in terms of registered staff's delegation to support workers. That is generally good news. There's a lot of good stuff, but there are some issues that still endure. Next slide, please. And what we did, we had a look at individual occupational groups from our survey. So this is showing for AHPs, nursing and maternity support workers the percentage agreeing with a statement. So we asked the survey, do you frequently think about quitting your job? You can see for nursing, nearly a third, 32.5% said they did. For AHPs, it was nearly 19%, so considerably less. And in all, this is not the full list of statements, but of all the statements we had, you as a workforce were much more positive than nursing and maternity. Even that question, I am fairly banded for the work that I do. A third of you feel that you are, compared to only 1 in 10 of maternity support workers. So across all of these, I feel a full member of my team at work. 75% of you said you did feel a full member of your team at work, compared to 60% of nurses and maternity. So as a workforce, you do seem to be more positive about developments at work and your experience of work than other occupational groups. I suspect, we haven't tested it, but I suspect that is because of the work that's been done, not only nationally, but also regionally and professionally. So, that is good news. Next slide, please. So we've already talked into the intro a bit about the AHP support workforce strategy, and I was lucky to work with the national team, professional bodies and others on this strategy, and which was launched in 2021, and it was launched, you'll see in a moment, in terms of its aims and objectives, explicitly to address those barriers that the workforce can face. So absolutely explicitly, there was a recognition nationally that resources were required to assist you as support workers, but also your managers and those who work with you to develop your careers, develop your roles, to develop your knowledge and skills, to think about how you might progress. There was more that was needed to be done. And I think, without question, I think Ascend is a fantastic resource for those of you who work in cancer care. But I don't think, I'm sure in England at least, this is very much the first of its kind. There's if you're a maternity support worker, you have a competency framework. You do not have the broad sweep of resources that AHP support workers have, and there are a lot of resources on there. And if you've not gone onto the NHS England site that hosts this, I would urge you to do that. And I'll talk a bit about the career framework, but other resources include aimed very much at systems, a readiness toolkit which allows systems and employers to map out effectively they are currently in supporting their registered workforce and provide opportunities for them to think about how they might improve the opportunities. There's something about Grow Your Own, which is about that. Really pleased, a session later is talking about get in and get on. It is that about how do we recruit people into the NHS. How do we then allow them to develop in their role? How do we then allow them to go further in that role, including for those who want to into pre-reg? So it's a bit around that. There's something about, and I'll talk about this, about learning more generally. And there's also a guide about, because I think qualifications for support workers can sometimes, the whole kind of landscape can be quite confusing. So we have tried to produce a guide that demystifies some of those education qualifications, what they mean, and their relevance. So hopefully, if you're not always entirely clear what it means about a level 3 qualification or what the difference between a certificate of higher education or a diploma of higher education is, then that guide hopefully gives you a easy to understand way of doing that. And there is also quite rightly a stress on public health as well. So, prevention, public health is clearly critical, and I think will come increasingly so. So there's an aligned strategy around that. Next slide, please. And I won't read all this out, but these are the aims of the strategy nationally. I think it's a very clear statement about wanting to have a skilled workforce that's well trained, that is able to develop itself, that variation that can exist from one employer, from one setting to the next, is addressed. And that can also apply to pay banding as well as progression opportunities or the tasks you are able to perform or not. But also recognising that support workers can be at the heart of improvement and transformation, including new models of care. Quite often, actually, and increasingly, it's support workers that are leading some of those changes. Thank you. Next slide. And I know you probably know this, but just say, I think there is a huge amount of resources on most of the professional body websites. There's images there from the BDA, the BIOS, the Optics Society has just enhanced and relaunched their support worker hub. The Society of Radiographers are about to do that as well, actually. And many of these resources are available to non-members. So certainly the SOR and the BIOS ones are available to non-members, or a lot of the resources are available to non-members. The CSP has long had fantastic resources for support workers, and the Ascend program as well, which we mentioned a few times. So whatever profession you work in, whether it's occupational therapy, podiatry, go and look on your professional body's website as well, because they will have information and they will have some standalone resources as well. And I would say, do consider membership. Great, again, that you've got a session on professional bodies, but do consider membership as well, because there are additional benefits for that. So there's a lot of resources, and that certainly wasn't the case 10 years or so ago. Next slide, please. Okay, so I think at the heart of the AHP strategy that we developed is the competency framework, and this does seek to cover all the AHP professions, so all 14 professions. It's written in such a way that hopefully, regardless of what profession you work in, it will be relevant to you, and it can help you identify your developmental needs for the present, but also in terms of where you want to go in the future. It was developed a wide range of stakeholders. We looked at job descriptions, we talked to professional bodies, we talked to support workers. A lot of people were involved in developing the framework to make sure it was as effective as possible. It covers what we call domains. I'll show these in a second, but which are essentially competencies, which are what are the knowledge, skills and behaviours you need to do the work that you do. We're really keen that it covered all 4 pillars of practice, so not just clinical responsibilities, but also things like leadership and research. Support workers work across all pillars of practice, and you'll see in a bit when I talk about future trends. I think the role of support workers on non-clinical pillars of practice, like, for example, education, are going to become increasingly important. I have met, for example, support workers who focus on research and quality assurance. So careers that are not just about clinical careers, but can be on those other pillars of practice, I think are emerging and will emerge and develop further in the future. But in terms of this framework, we wanted to reflect the full breadth of practice of support workers. We have got 3 levels of practice, and it is progressive in the sense that it builds from one level to another. So it is an opportunity to think about what I want to do next, what I could do next, what I'm not doing at the moment, but legitimately could fall into my scope of practice. One of the issues, which is still a bit of an issue actually, is variation in requirements for jobs. So if you go in NHS jobs, you look at any occupation, it's certainly not just true for AHPs. You look at job descriptions, person specifications in adverts for a band 3 in any occupation. What you can see is very wide variation in entry requirements. So some employers will not ask for a huge amount of qualifications or experience on entry, and some that will ask for a considerable amount of qualifications. So one of the things we wanted to do in this framework was to give employers some guidance about what we would recommend at each of those levels of practice you would expect a new recruit either to have on employment or to acquire soon after employment, because what we don't want to do is create unnecessary barriers for people. So as my life story, I didn't leave school with a lot of qualifications. Actually, we want to be able to develop people in work if they've not had the opportunities prior to employment. So it's recommendations around education levels and also around functional skills, so English and maths and digital skills. The competency framework is not about pay banding though, and I think quite understandably people can be a bit confused about that, because we do have the 3 levels of practice, and we do essentially have band 2, 3 and 4 for support workers. But just to say that pay banding covers is covered by job evaluation, and that picks on other factors like working conditions, physical effort, mental effort that aren't part of a competency framework. So you may be at one level in terms of the knowledge and skills and behaviours you need for your job, but you may be at a different level in terms of pay banding because of other issues just not covered by the competency framework. Generally, though, there probably will be an alignment between the two, but just to say, if you look at the competency framework and think, well, that's odd because I'm at a different pay band, there could be reasons for that. Next slide, please. So again, I won't read this, but just to give you, if you've not seen it, the 8 competencies that we've identified in terms of how we've clustered the knowledge and skills in the framework. And you can see there, as I said earlier, we've got leadership as a standalone, we've got research as a standalone, and we've also in terms of the framework, the last competency around personal professional values behaviour is around what today's about, actually, which is about self-development as well as taking care of yourself in the workplace as well. So we've got those 8 competencies, which hopefully certainly feedback from services and systems that have taken a competency framework, because it does work. It does work across occupational groups, and within that, hopefully, we've covered all the responsibilities and tasks and areas that you might cover. Next slide, please. So, as I said, there's 3 levels: support worker, senior support worker, assistant practitioner. There are so many titles for support workers. It is incredible, and actually for registered staff as well. So I have an aspiration one day that we might be able to reach a consensus about what actually various occupations should be called at each occupational level. But in terms of the framework, those were the titles we used. There's very detailed descriptions of the kind of general differentiations between those different levels in terms of the tasks that people perform, in terms of supervision, in terms of the education requirements. And I've just really sort of stripped that down to the very basics here, so you get an idea of that kind of progression. And as I said, this is about progression, actually. So we do talk about in it about how you should be able to progress from that senior support worker level into pre-reg if that's what you want to do. And certainly if that higher assistant practitioner level, particularly if you have something like a foundation degree or the assistant practitioner apprenticeship, you should not only be able to progress into pre-reg, but that prior learning should be recognised as well. So 3 levels, progression if that's how you want to do that, and details around the tasks and responsibilities in it. Next slide, please. Okay, so I was also asked to talk about the career portfolio, and I need to say here, and I'm not sure if she's managed to join us today, but this was primarily developed by Abby Hall in the Southwest, and Abby's a fantastic champion of support workers, has done amazing work. I'm going to quote her again in a few minutes as well, actually. So I want to give absolute credit to Abby for this. And the portfolio was developed because it did not exist. I mean, there were a few local examples, but we didn't have a national way that AHP support workers could record their learning, core career development opportunities, and actually move that between employers. So this is a really important part of the framework. It was developed regionally, but it's very much now sitting in the national strategy. And if you've not looked at it, please do have a look at it. And I'm sure it'll be referred to as we go through the day. Next slide, please. It aims to allow you to, in a structured way, to record the learning and the evidence of knowledge and skills that you've attain, so you can transfer that between employers. I've seen too often actually support workers have had to repeat training because one employer doesn't recognise the training that they did in a previous employer. So this is hopefully going to allow transferability of learning as well as evidence of learning. Allow you to develop identify future trainees and develop an action plan. It is absolutely centred on the framework, so it's absolutely aligned to it and linked to it. It can be completed electronically or downloaded and done manually. Clearly, that appraisal process is a critical point of this for you in terms of development opportunities, and it should form a very central part of that. But there are other ways you can use it as well to help your interviews, for example, to demonstrate your clinical competencies. And hopefully also, when you have that time with your supervisor, where you have time to reflect about an incident or something that's happened, something else that's happened, that you can use it there as well. So it's a really, I think it's a really critical document part of your portfolio in terms of how you not only develop yourself in the future, but think about your current work as well. Next slide, please. And it's structured so it allows you actually to summarize yourself, your work, who your supervisor is, your previous career history, where you think your current level of practice is. So looking at that at the framework and mapping your current practice against the levels in there. And then for each of those domains, those 8 competencies, thinking, how far I've achieved what's in those competencies. And I should say, actually, there's a lot within those competencies, not an expectation that you have to complete every single element of it. It may well be, or even every single domain, actually. It may well be that research is quite legitimately something you don't do in your job, so it doesn't fall into this discussion. It may be detail within some of the other domains are not also relevant to your job. So it is, it is flexible in that sense. But where competencies domains are relevant to you, how far have I attained what I need to be able to be confident and efficient at these levels, and what do I want to do in the future? Maybe actually I do want to think about research as a career, so how can I do that? Can I get involved in audits, in quality assurance? And it allows you then to develop an action plan for your career. Next slide, please. So that's just a screenshot of it. I mean, again, I'm sure you probably already have the links. I'm sure it may well be on I think it is on the Padlet actually. So do have a look at it, and that's an example within the clinical skills competencies of how you might map yourself against current level and think about what the next level is. So do go have a look at it. There is a explanatory document as well that gives you guidance on it before you actually use it. Next slide, please. I talked about evidence, and I think often when we think about learning, I think we can sometimes have a very sort of narrow view of what learning is. And I just wanted to stress here that learning can involve lots of things. This is clearly learning. Conversations you'll be having today, even what may be being posted in the chat at the moment, is learning. So it's not just training courses, it's meetings, it's feedback, it's your own decision to self-direct yourself, it's your practice, it's what you might observe, reflections, reading, learning from conversations. I mean, that is a small list of what learning is and what evidence is. And in reality, research suggests around 70% of what we learn, which is why local learning cultures, why culture is so important. But about 70% of what we learn is actually through daily tasks, that activity at work. 20% is what we learn through interacting with other colleagues, and only 10% is that formal learning, going on those courses. So the majority of learning actually isn't training courses. So when you're thinking about evidence, when you're recording what you do, then it is worth thinking about that expansively, not only in terms of evidence, but in terms of opportunity. So, going to that meeting is an opportunity to learn. So do think about learning expansively. Next slide, please. I mean, you've got the Padlet, so and there's a lot of there are a lot of places where learning is available, online learning, information about learning. I've listed them there. I picked out right at the bottom there the SCOR, because one of the things that the Society College of Radiography Support Worker Hub is trying to do is, and this will be available to non-members, is literally one place have every single bit of learning that is not only available in England but also in the other nations as well. So that may be worth when it's launched to have a look at also. But as I said earlier, most professional bodies also have information as well. So there's lots of places once you have identified your developmental needs, you can go to see what training, whether it's qualification or other learning like e-learning, you can access to develop yourself. And if not looked at NHS England Support Worker Roadmap, that's also very much a valuable resource. Next slide, please. Okay, and again, because of time, I can only really sort of briefly touch on this, but I was asked to think about this notion that I'm not hearing this quite so much actually. I had a week once, probably about 2015, and I did a talk at Broadmoor actually for West London Mental Health Trust, and someone came up to me afterward was in developing their career as support worker, and she started by saying, "I'm just a support worker, but I'd like to progress to be my grandmother actually was in hospital, and I visited her that week, and the support worker, as I said earlier, was brilliant, amazing, but she always started a conversation, I'm just a support worker. So I'd say, how's Nan? And she'd start, I'm just a support worker. And it turned out there was a bit of campaign. I'm not on X anymore, but there was a bit of a campaign a while ago around this phrase, which I think was heard quite often. And it says something about, I guess, status. I think it says something about how people can feel about themselves. So second mention of Abby Hall. Abby did some great research on AHP support workers. If you want this research, email me, I'll send it to you. If Abby's on the call, I'm sure she'll be very happy to do it as well. And she looked at how AHP support workers felt, and she looked at what factors drove those feelings around being valued or not. And what she found was there are issues about how empowered people felt, so what voice they thought they had to speak up in meetings, how much they had a sense of belonging to their teams, and the extent to which their knowledge and experience was acknowledged. So not just knowledge, but also experience. So that was recognised or not. And I've spoken to support workers who don't feel they can always talk up. I've spoken to support workers who identify practice they don't think is particularly appropriate and have not felt they've been able to speak up. So, yeah, those factors all drive that feeling of being valued. I'm a support worker, or not so valued. I'm just a support worker. And if you look at the and I do speak up. Voice, feeling you have a voice at work, you have a right to speak up and it's important that you do. If you look at the research more generally about how people feel, what needs to happen for people to feel valued at work in terms of more practical things, is things like leadership being clear. And I think it's great, and Bob, that leadership is clear about the importance of support workers. It is about the values and behaviours. Job titles do matter, actually. I still occasionally find, when I started working in for the CSP, it wasn't physiotherapy assistants, it was physiotherapy helpers. So AHP support workers were described as helpers. So titles and to what extent they articulate that value are important. Having clear scope of practice, non-hierarchical language, and expansive learning cultures, which simply mean there is a guide on the support workforce strategy about that. About learning cultures, but it's just making learning normal, making learning open for everybody, and involving everybody. So, I think this is much better. I don't hear this phrase anymore. I'd be interested if this resonates with you as support workers, whether you hear it or sometimes feel it, but it seems a lot less now, and I hope that is because of all the work that's been nationally, regionally and locally to recognise the contribution that you make. Next slide, please. I was also tasked to sort of think a bit about communication and collaboration skills, and I I could talk a bit about if you're interested in developing your communication skills, doing presentations, how you can approach that in a bite-sized way. Sometimes it can be quite overwhelming to think, oh gosh, I'm going to stand in front of an audience or sit behind a computer and talk to an audience. So it can feel a bit daunting, and there's something about taking bite-sized steps. But what I actually ended up thinking I'd say is there's this program called the Higher Development Awards. It was developed in West London by a colleague of mine, Dawn Grant, and the Trust in West London. It is available in numbers of parts of the country, delivered by colleges. It's free because they can draw on national funding for it. And it is a program, it exists at all levels, actually, level 1, entry level, GCSE level, A level, equivalent level, and foundation degree equivalent level. So there are various levels of this. And it was explicitly developed to actually build communication skills, leadership skills. So it's non-clinical program. It's accredited, so when you finish it, you have 17 credits, which, for example, if you want to go to university, will be recognised. And the feedback has been really great, actually, in terms of support workers feeling more confident in their communication skills. You do a service improvement project on it. So what I would say, something maybe you want to think about as a sector, if it's not available across Bob, if it's only available in some areas, is reaching out to local colleges, talking to them about it, and Dawn and colleagues will more than happily help with this to see if it can be introduced in the area, and if it is, then it's a fantastic opportunity to specifically address those skills in a health and actually social care. It's relevant to social care as well. Next slide, please. Right, final slide. So I was asked to also think about sort of trend and predictions for the future, and I think, as I said, I'd start. 10 years ago, I first spoke in Bob, and so much has happened in that time. So in 10 years' time, hopefully we'll be building on that progress. And obviously there are things happening. I don't have actual yet what, but things happening more generally. But in terms of support workers, I think what I'm seeing is firstly, I've said this before, but I do think those non-clinical pillars of practice like are going to be much more focused on than they have been for the whole workforce. Can be, if you are in research, from support worker to registrant, there's a pathway that does that. A number of professional body, the BDA, competency framework, the SCOR, education and career framework, does actually do that. It's out from support and assisted level right up to consultant level. What is expected at each of those levels in terms of those non-clinical pillars of practice. So future careers potentially in non-clinical areas of practice. Band 5 role is there. It's evolved. It certainly came out. It's actually now across all profession, support workers in maternity, in nursing. But although no one's charted this because it was a bottom-up evolution, almost certainly first evolved in AHP. There is some national focus on this role. So there's not actual national guidance around Band 5 roles at the moment. So there may be some guidance. I'm hoping there be some guidance, but also encouragement for those areas that don't have those Band 5 roles to think about developing them. Professional bodies become increasingly important. I think we'll continue to focus on support workers. There's been a bit, and I think this is probably because of the focus on nursing associates, which perhaps led to some foundation degrees, for example, not being prioritised, shift into training associates. I think there's a growing re-recognition of the importance of an assistant role as Band 4 practitioners in some places. The importance of those that sort of focus on specialists quite often. The need actually to have more of those across AHPs and ensuring that the university program is available, so you can make that step into this system. So I'm beginning to see, and I hope see news on because I have, they've certainly not gone away, and some of you may be APs, but I do think we will see hopefully some of that retreat, to be honest, being addressed. Possible alternative funding for non-apprenticeships. Well, I wrote this before the industrial strategy, and we were doing some lobbying around this. So I hope that there will be the case that for formal qualifications, it won't just be apprenticeships that the only route you can take. So there will be alternatives to apprenticeships, and some of those qualifications that sit in apprenticeship can be taught outside of it. So watch the space for that. But hopefully, it's going to be more flexibility around that, and hopefully also recognition of some of the pressures around releasing people to go on courses as well, because we don't just need programs, we need people to be able to go and attend them and then apply that learning back in the workplace. And again, something else I think there's been less attention on recently than certainly earlier in my career is that widening access to pre-reg. So how do you step from support worker roles into pre-reg degrees? How do we support that? How do we make sure, for example, degree apprenticeships are available across the board? How do we make sure all universities recognise prior learning? So I think because we need to boost supply, we've got a fantastic resource and support workers who know the NHS of all that experience that you have, but can struggle to make that step onto pre-reg degrees. Once you're on pre-reg degrees, you do really, really well, and attrition rates for support workers are far less than for traditional students. So hopefully there will be a renewed focus on pre-reg degrees. But when that long-term plan comes out, hopefully that will have specific policies and priorities for support workforce. So final slide. So thank you. I appreciate that was a lot of a lot to take in. That is my email up in the chat as well, and I'm very happy to. So do not hesitate to get in touch with me if you would like to talk about anything specifically. But thank you for listening to that.
Thank you very much, Richard. That was a beautiful presentation.
Yeah, brilliant, Richard. Thank you so much. Does anybody have any questions for Richard? I can just see comments popping into the chat. Oh, I've got a hand up. Please come in, Sarah.
So thank you, Richard, for the presentation. I'm a dietetic assistant, and this year there was apprenticeship offered to us, but there was only one space available for the whole of CLCH, which was very difficult to get in. The process was very long. There was a lot of interviews. I had to do my functional skills, maths and English, because they wouldn't accept my overseas GCSE. So there was a lot to do beforehand, and so I've got master's in nutrition. I don't want to be specific, but it's a very long process. And I don't know, is there an alternative to these things? Maybe to up a little bit rather than being stuck at level 3, level 4.
Yeah, I think yes is the answer. I mean, I think, and I know CLCH, and I think it's got a great record on developing support workers. It's got a great academy there as well. But that does sound too hard, doesn't it? That does sound not how it should be. And what the strategy says, and I'm sure they're fun. Actually, it is about addressing the bigger picture, making sure it can be with that. There are enough places for those who are able and want to do that, and that's why, as part of the strategy, we did develop this approach to grow your own. So actually, every trust should be thinking about progressing people. They should be thinking about that supply route into pre-reg.
Mm-hmm.
So I can't, I'm afraid to say I can't give you, a fine answer about what's going to change.
Mm-hmm.
What I'm hoping, and I know, is those sort of issues are recognised.
Okay.
I'm hoping, and I know that, and I'll be honest with you, I'm not sure you don't have to say which university it was. I think universities aren't always amazing at recognising some of the qualifications that support workers have.
Okay.
So I think there's a bit of a job there as well, actually, with the university side of the equation. So I'm hoping there'll be a spotlight, as I was saying earlier, on this and those sort of issues. So I'm sorry it's proved so hard, but hopefully, it will be easier because we need it to be.
Yeah, I'm just thinking, would this be communicated to our service manager and my line manager, because they're not aware of anything, especially in apprenticeship area. They don't have the information. We need to reach out to you guys rather than our service manager.
No, I think I'll just say briefly, I think that's a good point. I think there's a continuing need to raise awareness, not only to address some of the issues that people might perceive around apprenticeship. So and so I think there will almost certainly be some resource to assist about that, raising awareness. I think in terms of your question more generally, no, there will be hopefully national guidance, national strategy, which will then translate into ICB strategy and employer strategy.
That's very good. Thank you very much. Thank you.
Perfect. I'm just about time. We've got a couple more questions. So we'll just do these two and then we'll head to a break if that's all right. Very quickly, Richard, can I ask if these courses and its career progression is paid for by the trust?
So apprenticeships absolutely paid the trust, and the high development award I talked about will be paid by skills funding that goes to colleges, so that will be free to employer. I would argue CBD funding, if you had other training needs, should be. I think if you need a training program for your job, that should be paid for by your employer. So you shouldn't be, fair enough, you want to do something different in your own time, that's fair, but things should be paid for. But apprenticeships, absolutely 100% paid for by employer. High development board, pay for your employer as well.
Perfect. Jennifer, I think you're next. Oh, you're just on mute.
You are still on. Yes, that's good now.
We've got you. Perfect. Oh,
We can hear you.
Jennifer, do you want to pop your question in the chat and then Richard can put it up there? Is that okay? Perfect. And last question, I think, is from Nana.
Thank you, Richard, for the massive work you've done. And again, you've re-echoed the value our AHP support workers bring to the workforce, which is amazing. So my name is Nana Kese, and when it comes to the implementation of the Ascend framework, which is Aspiring Cancer Career Education Development in TBCA, that is my focus. My focus is with the support workforce, and with the brilliant body of work you have developed, I want to find out if there's been any correlation and any mapping that has been done in regards to Ascend from the national level.
Yes. So I'm lucky to be working with and continuing to work with the Ascend project nationally. We've just finished the National Workforce Survey, which is being signed off. So there will be a report of that, and we've analysed the whole workforce, but we have support work and supportive and assistive results, which are very similar. So actually we found very quickly, appreciate time. So we're like less than 3% of the cancer support workforce had access an apprenticeship, 53% would like to. So that gives you an idea of sort of aspirant workforce, but some of those challenges that we were hearing about earlier. And the Ascend programme will continue to build on its current resources, including some of those the principles of care, so those training. So yeah, if you're connected with the Ascend program in any way, or you'll definitely see this. If you keep logging on your Ascend web hub, and you'll see the results. Very much a work stream within Ascend is around the support and assisted workforce. Also, the other issues around progression further up for those who wish to. And I will say, there are issues that registered staff experience as well, and they it's not just that support workers have issues at work. It's across the board. But yeah, do keep an eye on it.
Thank you, Richard.
Thank you so much. So there's a few questions in the chat, Richard. I don't know if you might have a couple of minutes to pick up some of those.
Yeah, we'll do.
But can I just say, on behalf of everyone attending today's session, just wanted to extend a heartfelt thank you for a truly insightful, thought-provoking presentation. Your expertise and passion came through clearly, and your ongoing commitment to strengthening and supporting the AHP support workforce is inspiring, and we really appreciate it. So thank you for your continued leadership and for sharing your time and knowledge with us today. We have a break now. Please, could you be back in the room? We are running over slightly for 25 past, and we'll start again. And in the meantime, for those of us that are staying on, we will try and answer the questions in the chat. Thank you so much.
I did it.
And then we will move on to our next speaker, if that's all right.
Could you please let us know if you saw the link into the chat, please? And for the lunch break optional webinar, the link is inside the chat as well.
I can see them, Jayana. So yeah, it'd be useful if people would just put some thumbs up or pop a message in the chat. That'd be great.
Absolutely. Thank you.
I'm just wondering if I've got Gemma in the room, but I can't see them on my screen, so I'm going to say no. No, I don't think they are. Perfect. Okay, we'll just move on then. Grace, are you in the room? Sorry, I cannot see anybody on my screen.
I am in the room.
Ah, perfect. Thank you so much. Lovely. Thank you so much for joining us today. So we're going to head on to our next session, and Grace Smith will be talking us through exploring the lived experience of AHP support workers in the NHS. Grace, I will hand over to you, and people in the room, if you do have any questions, please feel free to pop them in the chat as Grace is talking. Thanks so much.
Lovely. Hello, everybody, and thank you for inviting me back. Doesn't seem that long ago we were all together at the Holiday Inn, some of us face to face, and I'm delighted to be back with you guys, and Bob always representing the AHP support workers, which is fantastic. If you wouldn't mind moving on to the next slide, please, Joanna. Thank you. So today I'm going to talk to you about the lived experience of AHP support workers in the NHS. Now, you guys, most of you in the room are AHP support workers, so I absolutely recognise who am I to tell you what your lived experience is. But this was a specific piece of research I did as part of my master's, which I finished, oh my word, I started it a very long time ago, but I finally finished it this year with my dissertation, which, as I say, looked at the lived experience of AHP support workers. So today I'm just going to give you a little bit of background. To be honest with you, Richard just covered a lot of the background for me, which is fantastic. So you won't have to listen to me talk about that. I'll go over the research review, highlight some of the key findings, talk about the recommendations, and then just a little bit of a call to arms at the end, to be honest with you, about what is it you can influence, what should you be influencing, and what should we be expecting of our colleagues around us. Next slide, please. Thank you. So for those of you who haven't met me before, I'm a registered physio by background, but I started way back, almost 20 years ago. Next February, my 20-year anniversary, which clearly I'm far too young to look at for that. Well, I started as a wee little band 3 rehab practitioner. And I was actually the guinea pig for the AP role way back in, crikey, I think it was 2007, 2008, under the leadership of Beverly Harden, who was our therapy manager at the time. I did that role for a good 7 years whilst I trained part-time to become a physiotherapist. Would not have been able to do it without being part-time and without the flexibility of my employer at the time, who gave me an annualised contract, and the university were really flexible with me as well around placements and things. I went on to do my band 5 rotations, specialised in acute. I'm not going to lie, love a bit of phlegm, love an ill patient, absolutely floated my boat. Specialised in respiratory, went on to become a ward sister and then a clinical matron. Now, following this and needing a little bit of time away from clinical after the pandemic, it hit us all hard. I was really fortunate to secure a post as a workforce fellow for Health Education England in the South East. And my boss, Rebecca Tyrrell, at the time, she gave me the AHP support workers, apprenticeships, and widening participation as my main work streams. It was an absolute privilege to work in that space, and listening to some of the conversations today, some of the comments in the box, and when I was first approached about being about this conversation, that work still but also the changing landscape and how far things have come even in the 4 years since I did that role. I then went on to be a placement lead, and I'm currently working in patient safety. Slight step away from AHPs. I just wanted to broaden my experience a little bit and also have a different lens into where AHPs can potentially be influencing within that space where we're not already. So that was me. Look how much younger I was, crikey. Anyway, moving on. So why did I choose to do this research? Well, lots was changing around us at the time that I started looking at what did I want to do my dissertation on. We had the HEE driven AHP support worker framework and all those wonderful documents and guidance that Richard shared earlier on with us. There was some really significant ICS and trust level change going on with the workforce programme, with the project that went on around return to practice, opening up leadership opportunities and really focusing on some of our more vulnerable professionals. And there really was a growth in opportunities available. Yeah, I was hearing, and it's, you know, it's great that today we've not heard it, and I am going to be the person that says it first, but yeah, I was still hearing AHP support workers be referred to as unqualified, which is like a red rag to a bull with me. Those of you who've seen me before, met me before, will know that that is something I will challenge on the spot. I like to think in a nice way, but I won't put up with that one. Staff weren't feeling including, and they were telling us, well, there aren't any opportunities to progress and develop, yet we knew those opportunities were there. So for me, it was about what's the disconnect, you know, what's imagined versus reality. In my head, all this is happening, but actually, how's that playing out for support workers on the shop floor? So what were the disconnects? And actually, was it me that had it wrong? And is it that because I have such a passion for this workforce? Is it because of maybe my own unconscious and conscious biases? I was reacting in a different way. It probably was about 18 months or so ago that I met with Richard actually to say, Richard, I need to do my dissertation and I want to do this, and I really want to look at why do our support workers get called unqualified? What's that about? How can we stop it? You know, and I was really, and Richard talked me down off a ledge a bit and got me to really focus in on, well, what is it actually, Grace, you want to look at, and where do we want to go? And through this and through some stringent rules the university put around me and like this really big idea I had, we were able to whittle it down into the research that I then conducted. Moving on, please. So the research itself, I developed a mixed methods research methodology, which is where you look at the use of both quantitative, so that was through an online survey, and qualitative data, which was through interviews. Now, the reason I went for a mixed methods approach was because a lot of, if you can find any research out there specifically about AHP support workers, it's one or the other. You either get surveys or you get interviews. And I wanted to get a mixed picture of what was going, because if the survey results are saying one thing, what's the explanation before that? What's the information that's going on underneath it? What's the reasons why? I approached Sajda and Gemma to say, could I use AHP support workers within Bob ICS due to one, existing relationships, but also the university were very firm with me about keeping the sample size slightly smaller to start with. You know, I would have done it globally if I could have. I was very enthused at the time. I needed bringing down a bit. And the questions were really focused, both in the interviews and in the online surveys, around your experiences of work. Some of that was based around the NHS staff survey. Some of it was based on the indicators of quality work, which we'll go through which I'll touch on in a second. Sorry, something's just popped up on my screen, so I can't. There you go. Sorry. I've lost my track now. Sorry, something popped up and blocked my slides. So some of them were focused on the indicators of quality work, and some of them were just things that I was interested in knowing about. Through the surveys and through the interviews, 8 professions were represented, and there was a mixture of acute and community providers, though I will be honest, there was one provider who both in the interviews and in the surveys was represented more than the others, but I can't, for the interest of confidentiality, I can't express who, but there was a slight dismay, but I haven't done any statistical significances to look at whether or not that biased it at all. Next slide, please. So as I mentioned, you've got the indicators of quality work. Now, this came from, Richard signposted me towards a good work paper that was published by the government back in 2018. And with that, they looked at what is quality work and why do people experience quality work. There's strong links between well-being and lived experience of quality work, staff retention, staff happiness, the actual effectiveness of work. And this research really shows that quality work relies upon work being fair and satisfactory with capacity for progression and fulfillment. Now, it's fair to say that as individuals, what is quality to me may not be quality to you, because different things motivate us. And we need to understand that our motivations impact our lived experience, but also our day-to-day motivations change as well, depending on whether we've had a good night's sleep, depending on whether we've had to wrestle a 2-year-old into the car, depending on the weather. You know, there's lots of things that impact us on the day. And it's always worth bearing that in mind when you look at research and when you think about actually what triggers you and what motivates you on a day-to-day basis. Now, if we can truly understand the lived experience of you guys as AHP support workers, that can help us grow a sustainable workforce, because it will help with retention, and it will also help us grow you both within your roles and beyond your roles. And those of you that have heard me before will know that I speak very much about, we do have support staff that want to grow and want to go on to become a registered professional. We also have an amazing pocket of staff that are happy in the roles they are, and we need to focus on them just as much as those that are going to be our future registered workforce. Now, as I say, next slide, please. It's really important to understand what motivates you guys from an AHP support worker point of view. So one of the questions in the survey asked, what's important to you? And you were asked to write, I say you, like you guys were the ones that filled in the survey, but when I'm talking about you, I'm talking about AHP support workers. What mattered to you? And what came back was the most important factor to you guys in the workplace is feeling valued, a good work-life balance and good relationships with your colleagues. Access to health and wellbeing resources was at the bottom, along with equality, diversity and belonging. Now, you can look at that in two ways, in that we don't care about ourselves, or we don't care about the EDI agenda, or we can look at it as actually, if you already know how to access health and wellbeing, or you know that there's work going on in the EDI space that you feel confident in and involved in, you may rank it as less important to you because it's not something that you see as absent. Now, the order of this may resonate with you. Some of you might view it slightly differently, but overall, that's what came back as what was important. So that was the main motivators for the AHP support workers who were involved in this research. Next slide, please. Now, what I did was I took the results from the survey, I took the interviews, carried out thematic analysis, and then I looked to see where the survey and the interviews either supported each other or refuted each other. And the main things that came out were job satisfaction, working conditions. Bear with me 1 second. Job satisfaction, working conditions, well-being, work-life balance. Well, we'll get to the next slide in a second anyway. So with job satisfaction, there were 4 main points that came out from both the survey and through the interviews, which was motivation, involvement in decisions, perceived value, and banding and pay. Now, what was clear that from a motivation point of view of our AHP support workers, both in the free text, the questions and the interviews, was that you guys love the fact you're working with patients, that you're making a difference, that you find meaning in your work, and that's what keeps you coming back day after day. That may not be news breaking to you guys, but you'd be surprised there are pockets out there where actually that's not why they do their jobs. They go to work just purely to do a job, but you guys find real meaning within the work that you're doing, which is fantastic, and that's what's motivating you. And that altruism is what comes throughout the research. Now, in terms of involvement in decisions, I looked at involvement in local decisions, in decisions with patients, as well as decisions when it came to more organisational decisions. And there was a bit of discrepancy in that the survey, nearly 80% of survey respondents said we are involved in local decisions. Whereas when I interviewed staff, they said that they weren't involved in local decisions actually, and often it felt as though decisions were made to them or for them. And unfortunately, it was clear from the interviews that there were examples where they felt as though the opinions of the registered workforce carried more weight, and that as a support worker, you're expected to just have a decision made for you and for you to go along with it. However, there was a really good example, and I can't go into too much detail because it would identify for that member of staff which respondent they were, who gave a really clear example of a time where staff had been involved in a local decision and they'd used NICE guidance, trust policy, as well as some of the evidence-based research into a particular patient group to support how they became a 24/7 hour service and how they couldn't do it without increasing the workforce, without impacting the workforce at the moment. So there was a real good example of how they used policies, guidelines to support a local decision that they were heavily involved in. There was a real disconnect, unfortunately, between local decisions and organisational decisions, with staff both in the surveys and in the interviews saying that they feel that a lot of the time it's lip service. Actually, the decision's made and you're asked questions about it afterwards to make you feel involved. So there's something in there, isn't there, about how do we, what's that disconnect, and how do we make it, how do you, instead of it feeling like lip service, how do you actually feel like you're making an impact and having a say? Now, in terms of working conditions, I'm going to skip over banding and pay because Richard did cover that, but also there's not much we can do to influence it at this point. So I do touch on it in a bit. Now, in terms of working condition, it was really great to hear that you guys had overwhelmingly a clear knowledge of your roles and responsibilities. You felt trusted, consistently trusted to do your roles, and were happy with your level of independence / autonomy. Now, we recognise that as support workers, you're never going to be fully autonomous because of the nature of the role and the delegation of tasks. But for me to hear that consistently you guys were feeling you knew your responsibilities and your levels of autonomy and independence were really clear, for me really shows the progress we've made over the last 5 to 10 years, as Richard touched, in terms of really helping not only our registered workforce to delegate appropriately, but yourselves as support workers to recognise your scope. Now, there are challenges with the physical working environment in terms of physical space, a bit of a bun fight for computers, not enough laptops, overcrowded offices, hot desking. Unfortunately, we know that space is a premium within the NHS, so there were things that really impacted from a working condition point of view. But what was really overwhelmingly positive to see was the fact that there was such a presence of good working relationships within the workplace. Now, I'm very much painting it to make it sound as though everything's really great. There were inconsistencies. There were issues with inconsistencies in leadership. So potentially one leader displaying one behaviour one day and a different behaviour the next day. Inconsistencies between decisions being made. So a decision might be made for one staff member or one staff group that would be slightly different for a different staff group. And that all did come through in all of those areas as well. Moving on to the next slide, please. So work-life balance, education, training and development were the next ones. Now, work-life balance can mean different things to different people. For some people, it means starting on time, finishing on time, not taking the job home. For others, it means being able to bring, your full authentic self to work. So it's really important to take stock of yourself as what does work-life balance mean to you. Now, there was really strong evidence actually that as a group, you do experience quite high levels of stress, burnout and exhaustion. So it's really interesting that was highlighted as being a real issue. It didn't translate into intention to leave, but also access to well-being and resources wasn't a priority. So is there a mismatch there in that you don't recognise you need that well-being support, or that is it the fact there's the presence of a supportive workplace and good working relationships that negate it? And that's something that definitely could be explored a little bit further. And there were a few occasions actually during the interviews where I heard things like, oh, if I go home exhausted, then I know that it's been a successful day. And I think it depends on your interpretation of that, because, there's that actually is going home exhausted with barely enough energy to talk to your loved ones the right thing to say it's a successful day? Is that the individual's mindset, or is that the mindset that the workplace is putting on the individual? I know for myself, when I used to come back from a 12-hour shift as a matron, there were times I'd come in through the door and, my boyfriend would know not to even say anything, because what a day it had been. Of course, he'd say something. Often it would be, do you want a glass of wine? But, you just got to think about the individual in this and whether or not actually them saying being exhausted is a successful day, and I would have really liked to have got underneath that a little bit more, but I had to stay within the confines of my research. But it's food for thought, and for me to think about if I was to do some future research in this, or if somebody else was going to pick it up. And I think for me, it's about just reflecting yourselves as to what you want as a good work-life balance and how your perceptions are impacting that as well. Now, in terms of flexible working opportunities for the support workers came across more in things like I can turn up slightly later for work if I've got an appointment, or I can leave later, opposed to set shift patterns like you might see with the nursing staff and healthcare assistants. Now, annual leave was a really interesting one, and for me it was a real missed opportunity that I didn't really ask about annual leave in the surveys, because although I did ask about, you know, what's the process for annual leave during the interviews, what came across was there was a real lack of parity and consistency between staff either having annual leave approved, so some staff waiting up to 6 weeks to have that annual leave approved, by which point that cost of that holiday has probably shot up, let's be honest. But also some real challenges around which staff are prioritised for which times of the year. Now, please don't think I'm saying that those of you who have children should not be given annual leave around half terms, summer holidays and Christmas. That is not what I'm saying. But the impact of staff who don't have children being at work during those times and potentially then not being able to spend time with nieces, nephews, grandchildren, that, you know, just thinking about it from that side as well. And that came across really strongly in the interviews, actually, is around when staff are prioritised, and staff with children being prioritised even over staff who perhaps have got families that live abroad, and not being given the time to go and see your loved one abroad. So just food for thought, and I'm not saying this is for everybody, but that came across really strong, and it was quite hard to hear, actually, the impact. And I personally don't have children. It never really bothered me working the holidays, but now I've got nieces and nephews, absolutely it would bother me, because when they're off from school, I want to be fun Auntie Gracie chasing them around with the water balloons. So just food for thought, really. And as I said, it was a missed opportunity for me for not asking that during the surveys. Now, in terms of education, training and development, you know, there was evidence of appraisals taking place, and most staff reported, so 86% of staff said that they'd had their appraisals in the survey, but yet none of the interviewees had their appraisals done. So, you know, I wonder if what that discrepancy is there, and obviously I'd like to get underneath it a bit more just to understand what staff understand to be an appraisal and whether or not that appraisal was meaningful to them. Staff did say that the appraisal met their needs. However, without looking into detail, we wouldn't know if it was addressing their PDP or just the fact that they're getting the flexible work they need. There was fantastic evidence, and I've got to admit, I did expect this of Bob. There was fantastic evidence to suggest that the support workers knew how to access training resources and that they were really self-motivated in doing this. There were high levels of clinical supervision, and this was shown within the support workers in the interviews and within the surveys. There were some challenges. There was some free text comments left, and some comments highlighted during the interviews around sometimes it feels as though registered staff are prioritised for time and for funding opportunities. And although the support workers seemed to understand that, they were also really open in saying that the staff come back and actually share with them what it is they've learned. So although they're not getting to go away and do the training, they are still learning from it indirectly. And I do think it's important to just think about government funding that comes down for registered staff, not necessarily for our AHP support workers. So I know that's not great for our support workers, but it's not always the registered staff's fault, you know. Moving on. So does it tally? So you guys told me that you want to feel valued with a good work-life balance, with good working relationships, a satisfactory level of pay and opportunities for flexible working. And I've put yes, but. So yes, you guys do feel valued, but there are challenges. You know, do you have good working relationships? Yes. Yet again, there are challenges. Work-life balance, I've put yes and, because for me, that seemed like the area that we were really getting right for you guys. Moving on. very conscious of time. So overall, you know, there was clear evidence of progression, education and training, both on and off the job, supportive working relationships and a work-life balance for you guys within Bob. However, there was evidence of exhaustion and burnout, a lack of physical resources in terms of space, laptops, like I said, that bun fight for desk space, inconsistencies in the workplace, in decision making from your line managers and from leadership styles, and parity of decisions that are being made for both registered groups and within staff groups themselves. But overall, absolutely, the lived experience of AHP support workers is positive. It went in with the quality indicators of work where you guys showed that you know, if you look back, it was around having a work-life balance, about opportunities for progression, and for that, like I said, the work-life balance. But ultimately, it's about having fair and satisfactory access. And that's where the parity becomes a bit of a challenge within Bob. Moving on. So from terms of recommendations from practice, so there were 4 main recommendations for practice. One was around developing formal and informal processes to improve AHP support worker involvement in decisions. Now, that could be as simple as just a tweak in meetings. There was evidence of meetings going on, say, for example, talking about the physiotherapy caseload, but the AHP support workers who are going to be going off and contributing towards that caseload are excluded from that meeting. And for what reason, you know? So it's just about looking at your processes. And I guess for those of you that are registered or online managing supporting AHP support workers, and those of you who are support workers within the room, just thinking about what is it you've got in place at the moment that involves you in decisions. There was evidence throughout the research that you know, as support workers, you were really involved in decisions around the patient, but not necessarily around the work that you're doing and the way in which you do the work. Something around developing internal mechanisms to monitor for parity and equitable division. That's a really wordy way of saying, basically just making sure that things are fair. You know, if somebody's requested time off over the summer holidays and the fact they don't have a child, is that really fair? Just, you know, and for some of you, that's probably, if you've got children, quite difficult to hear. But we do just need to think about making sure we are being parity. There is that parity. And when you think about how that might then knock on to our colleagues, say on the wards, who perhaps may get less desirable shifts, so Christmas Day, Boxing Day, bank holidays, weekends, night shifts, you're just thinking about that knock-on effect. So although in AHP support world it might not be a huge issue, it could be for other professions. And I've said about implementing leadership and development opportunities for staff. Now there's loads of work going on within that, but I'm being a bit more specific in there in terms of making sure we've got that consistency across our leaders and that consistency across the messaging that goes out. That's really important for you guys to feel that you're getting fair work and fair opportunities. Now I've put the review, the use of and division of CPD budgets. Now you notice that I've put wings on that. That's my kind of a bit like pigs might fly. You know, this does rely on budgets coming down from government that say that it's okay for us to use funding with our unregistered workforce. And I know through my previous roles that there are pockets of trusts and organisations where they look at their overall budget and then they allocate it per head opposed to per registered, per unregistered. So I guess for me, that's just a bit of a prompt and a jog to those of you to just think about how you're using your monies. Moving on. Now there are, I'm very conscious of time, so if we were to put those recommendations into practice, there is evidence out there, not through my research, but through previously conducted research, some of which Richard's led on, that those changes in practice will improve job satisfaction. They will increase your perceived value. And if you feel more worthy at work, you're going to enjoy work more. It will support with health and well-being, improve retention, employee performance, increase staff engagement, and again, that joy for work, and reduce stress, which, you know, not everyone wants to go to work stressed. You might go to work stressed because you've had to wrestle the 2-year-old, like I said, but ultimately work shouldn't be causing you the main source of stress, and you shouldn't be bringing it home. Now, if you could move on, there are some enablers. There's lots of enablers to practice. We've got, you know, digital collaborative platforms. Look at this, you know, we wouldn't have been able to do this years ago. Coming across, well, I'm sitting in Basingstoke talking to you guys that are all up in, I can get it. I always say it is Buckinghamshire. I always say Bedfordshire, which is clearly not where you are. You know, Richard, I think, is in London. So, you know, we're all coming across from lots of different places. But, you know, we've got digital collaborative platforms now. We've got no excuse. You guys have got the Padlet, which makes my heart so happy to see you guys are still using that. There are resources such as free mentoring and coaching. There's trust functions such as OD, through organisational development teams, transformation teams, electronic rostering that can support with parity. You've got national and local resources that can support. Really importantly, though, we've got shared values. We all want to do what's best for our patient. Now, I've put standardised expectations, but to what extent? I really agree with Richard when he talks about our job titles. Why do we have 27 different job titles for a therapy assistant? What does it actually matter? And what does it mean to the patient? The patient needs to know who you are, you know? So those standardised expectations around what our job descriptions are called, what's expected of us in our roles, what's expected of us in terms of when am I going to find out I can book that holiday, you know? And there's also NHS terms and conditions, which I think often we forget they're there and they are on our side because they get buried away. Unfortunately, there are barriers, which is on the next slide. Now, barriers include attitudes, beliefs and behaviours, and some of those we can only tackle by challenging them, by role modeling, by positive behaviors, by calling things out. And I don't mean, you know, walking up to someone and saying I disagree. You know, it's about how you do it in a supportive way and how you change hearts and minds. No one's ever shamed into a behavior change. Okay, it's about how we change hearts and minds. We do need to tackle some of the inconsistent leadership behaviors. Now, it's okay for someone to one day be in a good mood and the next day not be in such a great mood. That's not what I'm talking about. I'm talking about the decision making and making sure that although there is a standard level of process and guidance, you still need to individualise that to people. Barriers such as set working patterns, the reduced staffing levels and the impact that has on, you know, things like clinical pressures resulting in reprioritisation. Unfortunately, as much as I said that national policy can be an enabler, it can also be a barrier, as can Department of Health budget setting, especially in the climate we're in at the moment. And I recognise some of you were putting in the chat, you know, around the impact that the budgets is going to have on things like apprenticeships and opportunities to access training. My final slide is just to ask you, what is it you can influence? You know, somebody made a comment about how, you know, I asked my line managers about apprenticeships and they don't necessarily know the most up-to-date information. And I guess I'd ask you, is it fair to expect your line manager to know the most up-to-date information specifically about apprenticeships? Because actually you're the one that wants to go away and be an apprentice, but what you can do is you can go and find out all the information you can and then find the right people within your organisation. I would absolutely expect your line manager to know who to signpost you to. But what can you influence? What can we influence together? What motivates you? And we hear all the time, don't we, about doing, you know, the things that annoy you, do less of the things that annoy you. But actually, let's do more of what's good. So what motivates you? What matters to you? What makes your heart happy? And what at work makes you want to poke your colleague in the eye? And really look at what is it that, I don't recommend poking your colleague in the eye, by the way, but what is it when you get underneath it has made you frustrated on that day? What can you do to influence it? Have those conversations with your line managers, have those conversations with other AHP support workers, because together you do have a collective voice. You've got roles such as Gianna's, you've got Sajda, you've got, I didn't catch your first name, I'm so sorry, but G Conway, you know, they're absolutely actively to work and promote you through an AHP support worker. You've got Richard that's lobbying for you guys, and you've got me that's still walking around bashing people that say unqualified, metaphorically, you know. But think about what can you influence. Richard said about your story, Richard said about work that's imagined. What can you change right now and then? Okay, it's not always up to everybody else. And that is my lecture. I'm going to get down off my soapbox. Has anyone got any questions? I haven't looked at the chat at all, so I will look at it after this and get back to anybody. Sorry, very conscious I ran over as well.
Thank you so much. As you can see from the virtual claps, that was absolutely amazing. Thank you so much for joining us and sharing your research. It definitely brings out really much needed evidence and insight that we're striving for. So thank you for that. I think if Geraldine's placed in the chat box that if anybody's got any questions, if they could place them in the chat. And Grace, if you wouldn't mind just going in and answering them.
Yeah,
I am
absolutely.
mindful that we cut our break short previously as well, so really would like to give people an opportunity to be able to step away from their screens, take a comfort break. But I think one thing that I would like to say, just to add my reflection, is when you talked about the lip service and what you say, and reaching out to our support workers to kind of say what you say makes an impact. And this is why we have our Bob AHP support worker network. It's a safe place for our support workers to come, discuss, and come together. The meetings aren't recorded, and sometimes we often reflect that we'll have a really good speaker and we're like, oh, we could have recorded that and shared it with everybody, but then it's just kind of also recognizing that it's that safe space. So please do come in. It's not just lip service, we really do want to work together with you all. Thank you so much, and we will be returning back at 11:05 and be joined by Shilpa Butt and Claire Wardle to talk about career conversations, get on and go further.